Hello and welcome. This presentation is primarily focused on the use of Clostridium botulinum toxin in the treatment of bruxism. It will start with an introduction to the phenomena of bruxism, discuss what we know about it, and describe the many dental and facial problems associated with it. A discussion of the recent literature on the effect of botulinum toxin on bruxism events will be discussed. At the conclusion of this presentation, participants will have a better understanding of the management of patients with chronic bruxism with use of botulinum toxin. An international consensus meeting was held on bruxism. Labizu and other authors published the results in the Journal of Oral Rehabilitation in 2013. In this meeting, they established the definition of bruxism. Bruxism is a repetitive jaw muscle activity characterized by clenching or grinding of the teeth and/or by bracing or thrusting of the mandible. Bruxism has two distinct circadian manifestations. It can occur during sleep, indicated as sleep bruxism, or during wakefulness, indicated as awake bruxism. It is generally thought that more damage occurs during sleep bruxism as the patient is asleep and without the defenses as you would have during the day. I think of chronic bruxism as the enemy of dentistry, as it is so destructive. Even the strongest restorative materials fail, dental implants fail, teeth break, and even the temporomandibular joints and other osseous structures are affected. The physiology of bruxism is very complex, and there remain a number of unknowns associated with the phenomena.